Well, finding happiness with your health can mean taking care of yourself inside and out. Over time, age can change the way that you look. And if you're ready to turn back time without invasive treatments, it may be time to look into surgical arts, and you want to check out the Sacramento Surgical Arts. Sacramento Surgical Arts specializes in cosmetic, facial, and oral surgery and can actually help you get the look that you've always wanted with both surgical and non-surgical procedures. Here to explain more about some of their cosmetic services, including neck lifts and chin implants, is Dr. Heir of Sacramento Surgical Arts. Welcome, doctor. Great to have you on the show.
Thanks. Nice to be here again.
So let's talk about neck lift and a facelift, which I'm more common with. So what's the difference between the two?
Well, everyone uses the term facelift, and most people don't undergo a facelift. A facelift encompasses the forehead, the eyes, the mid-face area, and the lower face. Most people undergo a lower facelift. So the terminology is just thrown around, but for the purist, a true facelift encompasses all aspects of the face, and a neck lift encompasses just the neck-chin area. Lower face will also encompass above the jaw angle line.
Okay.
So subtle differences, different procedures, and different amounts of recovery.
So how do you know which one it is that you need?
Well, unfortunately, no one here is a great candidate for either procedure, but patients generally will come in and they'll say, I don't like this, or I don't like this. So where they put their fingers sort of tells you exactly what they need, and they know it, and obviously they have no medical training, most of them. So if they come in saying, I don't like this, then they need a lower facelift. If they say, I don't like this area, then they need a neck lift. If
and
they
you,
start,
as a professional, clearly you look for those target views, right?
Exactly. You can have drooping of the jowls, you can have some mid-face ptosis or dropping of the mid-face.
Let's talk about what the neck lift does. Does it, because I mean, I imagine a lot of people come in because they don't like kind of a sagging underneath their chin, is that correct?
Yeah, it's sort of called a turkey neck or a gobble neck. And,
I've heard it called that,
and they don't like that. I actually had a gentleman who lives in China, and he has family here, so he visits often. His wife works in China. He flew in, we did a neck lift on him, got rid of the turkey neck, did a little chin implant as well, and then off he went. So recovery time shorter and so on.
Oh, wow.
And I think there's a picture of him from the front, a before and after. And on the before, you could see a little bit of the turkey neck hanging. On the side views, you can see even more of it. Now,
oh, wow.
He was a great candidate for a lower facelift, but he did not want the more extensive surgery. So as long as we discuss the limitations, and there's a perfect view, and you can see the remarkable difference between the before and after.
And how long do these results last?
Well, just like our own faces and our own bodies don't last forever, their aging process continues. In general, you can get 5 to 10 years out of any procedure. Obviously, depending on how well you've already taken care of your skin, how well you're going to continue to take care of it, will affect how long the results last, similar to a car. You know, if you get maintenance.
Yeah.
So they can last a very long time, but on some people they can last 5 years or less.
Are there any visible scars with that?
Well, all scars are visible. There's not a single surgeon out there that can do scarless surgery. It's just how well we can hide the scars, and we hide them in creases that are normally part of the aging face. In women, it's a little easier because they wear their hair down and so on.
Yes, that's true. And we wear a cover-up.
Exactly.
Makeup.
Exactly.
Are there any other procedures that go well with the neck lift?
Well, the biggest one that we do along with a neck lift is chin implant. It's a smaller procedure, takes 20 minutes to 30 minutes to do, and it's a remarkable difference. And you know, this is just an example of a young lady before and after. And you know, on the frontal view, it's not too bad, but when if you look on the side view, it's quite a bit of
a difference.
Can
tell a big difference there.
And it normalizes the face in terms of equal thirds. So.
Oh, wow. So it literally is more balanced.
Exactly. Gives them more balance. Our eyes like balance.
Yes.
So
we are attracted to balance. Yeah, I've heard that before. How long was the recovery time on something like that?
Chin implants, just a few days. Obviously, the incisions continue to heal. A neck lift is about 10 days to 14 days, and a facelift is definitely 2 weeks, a lower facelift, 2 weeks up to 3 weeks, depending on how much bruising they have.
And what about pain and pain management?
Most patients will have little to no pain. Vicodin the first couple days, and that's usually it. Then they can switch to Motrin or Advil or Tylenol, and that's it.
Yeah.
And part of it is the technique that we use. We use a tumescent technique. So when they wake up, all the nerves have been numbed, and so as the nerves come back, the feeling is normal. It's when you don't use numbing agents that all of a sudden they wake up from anesthesia and all the nerves start firing.
It's very real.
So this way we stay ahead of the pain.
That's great.
So it's relatively painless.
And how do our viewers reach you?
They can just look us up on the internet, sacramentosurgicalarts.com, or they can call Gina, who's our cosmetic coordinator, and when they call, just ask for her.
Okay, great. Thank you so much.
Thank you.
Really appreciate it. And I learned a lot.
Well, thank you.
A whole bunch of new stuff I never knew. All right, everyone. Well,